You got all the calculus off, the roots are clean, you're gonna go in there and remove the smear layer. Now you're gonna use a laser like shock waves. And those shock waves, the water's gonna hit that, create those shock waves, and get the smear layer off the teeth, which is anything, just like when you do restorative dentistry, adhesive dentistry. You wanna get that smear layer off before you use adhesion. Same thing, you wanna get that smear layer off if you're gonna cause any kind of regeneration. So it's not only shock waves, but also that fine etch we were talking about on the root surface. Okay. The radial tip there is just going to put a real fine etch to that root surface, almost make it chalky-like. And we'll try that today when you're in hands-on. Make it chalky-like. That will create the fibroblastic attachment quicker here, and preventing the epithelium from downgrowing in the next step. Okay. So now we've used erbium twice. We used the first time to take out some of the toxins, remove some of the calculus. Second time now is remove the smear layer. Now we need to create a clot. And this was your question, was to have, if you don't have bleeding, how do you create bleeding? You can use photobiomodulation. I don't find it that great. So what I do is you take an endo explorer, okay, and you can actually poke it into the bone. You can go in the periodontal ligament, scrape it around the periodontal ligament, vascular, okay. And somebody in Slovenia asked me, well, what happens if it comes from the soft tissue? Bleeding is bleeding. I don't care where it comes from. It's all into blood, you can coagulate. It's about stabilizing that clot, because you don't know if it could come from the soft tissue. But you basically seal the soft tissue, so chances are it's not going to. But if it comes from the periodontal ligament or the bone in here, which is great, you have bleeding that oozes in there. If you don't have bleeding, you can't create a clot. Really important. And sometimes you look in there, because it's a bloodless procedure, you have to. If you're trying to do a clot without that, like Eli said, you create so much heat and throw everything out. Now you're damaged. You don't want to damage anything. The whole thing is you want to make it as biological as possible so it heals. Yeah. And I'll follow all the biological principles. There's nothing we violated here. Somebody said, well, the laser did that. And the laser didn't do anything wrong. It did everything right. Okay, so now let's go through the procedure so it makes sense. So now this is called twin light. We used to call it WPT or FAST. We call it twin light because it's two different lights.
Good question.
Yes.
So you don't build this out as a flat root plane. It's
Now with the erbium laser, it's osseous surgery.
osseous surgery.
It's osseous surgery. As soon as you go into the bone and touch the bone with the laser, which you do, remember I said you put the radial tip right in there, all of a sudden you're etching the bone, creating the bleeding from the bone. Now, if you start doing bone grafting, it's even more than that. And we'll show you how we get when we do bone grafts, we'll show you how to get into an infrabony defect with the radial tip and just clean the whole defect out with that. So it's perfect, get all the gray areas.
So when we go the erbium to remove the calculus, this is when you say it hits the bone?
Yeah, well, you can remove the calculus is one thing, but you can go down to the first. We went back to this step. How to get this far away? Okay, so this step here, remember I said you take the erbium and put it right in the bone. That's right there. Okay, so let's talk about twin light. Now, this is my laser. I want to show you a couple of things about this that are really important. Okay. First of all, a thing you don't want to do is have this fiber hang here, because someone's going to catch it with their purse, their foot, whatever. And if you think that doesn't happen, that's what happened. They broke my fiber. Okay. So I started the next day and put the fiber on, and I found nothing through the handpiece, and it lit up here. That fiber is garbage. Okay. So when you have it hanging like this, it's a problem. See my Genova? It wraps around the machine. Much safer. The patients can't catch that. Patients don't do it on purpose. But if you took your purse, and I'm not saying it's you, if you took your purse and you came like this, what was the first thing you're gonna do you're gonna pull a little harder because it's stuck on something? Well, that rips my fiber. And Mr. Smith, when he comes and puts his foot in there and around the chair and he gets his foot in there, he's trying to move his foot, and it's like, and I've told the couple, you move your foot anymore, you break that fiber, it's $800. So let me untangle you. So my assistants know not to leave the fiber like that. Somebody screwed up. And it's gonna happen. So always have a second fiber, because when that happens, guess what? You can't do your procedure. You send the patient home. Okay. So always have a second fiber. So this is my 400 that broke. I take that off and put my backup 300 on, and I use it until I get a new fiber. Okay. Now, who has a Genova? Anybody have Genova? You have a Genova? Okay. Anybody have Marcos? Okay. So we have two photobiomodulation handpieces. One is the Genova, and the new ones are the Marcos. And we'll go through all in detail later. But the Genova is nice because it stays here in the 200 micron port. That's the middle port. 300, 200 dead port. So that's the middle port. You never take it off. The Marco goes into this port. So we have to put the Marco in here, take this fiber and put it in the dead port. And then when you're done, you switch them back again. Make sense so far? And this is why I say if you don't need a Marco, get a Genova. Because this is what happens. The coupler that you put in and out decouples. Yeah, not nice. I went to go connect it, and I go, what the heck is this? All the parts fell apart. So or your staff holds it by here, and if you keep on twisting that, what happens is you break it here. So this whole connector is worthless. So if you do want to do some photobiomodulation, but it's not a huge part of your practice, you need the 43 millimeter Marco, then you stay with the Genova and it stays in the 200 micron port and never remove it. If you get the 300, which is the Marcos, then you're always going to be switching back and forth, back and forth, back and forth. Does that make sense? Okay, so let's go over now. This is your tipless handpiece that you're going to use. I don't use tipless that much in perio, probably only 5% of the time. Though I do some things with it. This is your tipped handpiece. Both of them have mirrors in them. There's your mirror. I'm going to show you how to clean those mirrors in a minute. Mirrors have to be taken care of. If you want to use periacral, surgical super glue, there's two different types. One's more high viscosity. I don't like that one. It sets way too quickly. Get the regular version. And get the purple. Don't get the clear because you'll never see where you put it. I went to go teach someplace and they had clear. I couldn't even see what they were doing with it. So get the purple. Just warn the patient there's a purple tinge to it. Because I had one patient freak out because his gums look purple. I go, no, this is the surgical glue. Okay, and we just put it on with an applicator, which is, if I'm doing a graft or a small area, or with squeeze eyes. And we put Vaseline on top of it. And you don't even need to use it, but I put it on everything. If I'm suturing, I put it over the suture so they're not sticking on gravel. If I'm doing a graft, I use it on a graft. Okay, I don't use it on implants.
I know why I use the pipette because stuck.
Okay, so what you do, well, that's a good point. So with the pipette, what you need to do is cut the tip off. It does get stuck. And you don't touch the tissue. You gotta stay about a half a millimeter to a millimeter away from the tissue and flow it out. As soon as you touch the tissue, it pulls off. And it's gotta stay dry. So if you use it on a wet surface, let's say it's bleeding, you gotta stop the bleeding. Okay, so it's gotta be dry. And then you just cut the tip so it's about that, and then you pull it and just flow it on about a millimeter, half millimeter away from the tissue.
So the purpose of using that is to prevent from bleeding?
No, the purpose of that is to seal the area. So you're going to see when I do the surgery that I will go in there and hold the tissue there, drop of periacral, and when I let it go, the tissue stays there. Okay. It's also to seal your knots over all extraction sockets. So I'm doing a membrane, I'll seal the edges of the membrane and the socket because the membrane is still exposed, but the patient can't take their tongue and flip it up. So we use it a lot. Okay. So these are some of the things. This is what Eli was saying. This is the flat variant. This is the radial or X pulse. And they changed the names. Okay. The flat is end cutting. This is side cutting, 85%, 15% on the end. This is your fiber, and this is a tip carousel for tonus cells. If you want to put your tips in them. I have 3 of them, that's the third one. And what we do is put all our tips in them and just throw them in the autoclave. One's in the autoclave, one is in the autoclave.
Oh, you put the tips in there?
Yeah, and then throw them in the autoclave. And then when you need it, we have a piece of tape, you close this and put a piece of tape over. And when you need it, you take it and you just kind of look around, you kind of go shopping which tip you want to use for the day.
I just put the tips in there.
Yeah, they all sit, there's I think it sits 6 or 7 tips.
Okay.
You put a tape, what's the reason for the tape?
You just put the tips in here, they slide right in.
For the tape, you said tip, not tape. Oh, tip.
Tips. Yeah, tips. And then you just put it in the autoclave. So that one, you know, two of them are always in the autoclave, or, you know, one's in the other room, and then I'm using this one. Much easier. Now, let's talk about the fibers. I told you there's two fibers. When you buy your second fiber, buy the 400. Don't buy another 300. You'll see, you'll love the 400. Okay, you'll love the feel of it. It's just a little stiffer. Now, when you use that, there's cannulas. There's 3 different cannulas. Fatona sells this one. Literally, it's awful. It's awful. You can't get to the distals of teeth. You can't get to the linguals. You want to buy this one, and it's not sold by Fatona. You didn't hear that from me, but you buy it from Practicon. Practicon Dental.
Oh, Practicon, okay.
Practicon Dental. And it's called the 60-degree tip. All you do is put Practicon, Google Practicon, 60-degree tip. And you'll find that. They're not cheap, but they're not that expensive. This is the metal tip that they will sell you. Metal is very dangerous. I'll show you some pictures of metal tips. What happens to them. You have to be very careful. This I find will do about 95% of what you need done. This will give you about 30%. And this I don't use anymore because these are so good. But it makes, that makes sense? I just gave you a huge tip without making any difference. Okay, so these are, when you buy your tips, always buy the longest tip. That's what this is. Always buy the 14 millimeter. Why? It's because you're going to polish them. This was a 14 millimeter. Not too long ago. Yeah, exactly. Now, this is really short. It can be used for the distals of the second molars. Because if you use a tip like that, a lot of times if you move your hand a certain way, it's caught in the pocket, you'll snap the tip. This one's less apt to snap. So you can use the tips all the way until they get about here, and then they're garbage. On the variant tips, notice there's a glass ball. Only the variant tips have a glass ball that focuses the energy. The sapphire tips do not. But that glass ball, if it breaks, you get no energy through your handpiece. So all of a sudden, you know, Monday morning you go and use your handpiece, and all of a sudden it's just spitting water and nothing's moving. The first thing I always do is to make sure all the connections are in. You know, because sometimes one of the connections falls out. If both connections are in, the next thing I do is take the tip out and make sure there's something in there. And then if that doesn't work, then maybe the water jet's plugged in the handpiece. And then this is another tip you want to listen to. So if the water jet's plugged, you take the air in the water and you switch the hoses. Come out of there. And you put the air all the way up to 10. And it takes the water jet and just blows it all out. Okay. If you want, I can show you when we get the hands on. But it blows it all out and opens up the water. And then you switch it back. Anyway, so those are the tips. So in perio, those are the 2 tips I would recommend for perio. The 500 is a little too thin, the 400 is worthless. But the 600 is perfect for this. Okay, now, what happens when you need to sharpen the variant tip? You take the brass porcelain polishing disc, this is on a Dremel, and you rotate it. You remember Eli said they get dull. Well, I'm going to sharpen it. This is how I sharpen it. Pretty simple. See how it's getting sharp? And as I'm rolling it, I'm just pushing it a little bit. There's my radio firing tip. Because what will happen is this tip will get dull. You'll lose the tip on it. I mean, you got this 14 millimeter tip, and if it gets dull, you got to throw it away. Okay. So you can use these tips all the way until, like I said, they get it all the way down to here, and then you probably have to throw it away.
How often do you do that?
Every day. Every time almost every time I use it, because it gets dull. I mean, sometimes it didn't because I didn't do that much. I did one little spot, but most times it does. So before I throw it in the autoclave, I just sharpen it. If it's a flat tip, sometimes the edges get round. So I'm going to go and flatten it out again. Okay, make it a flat tip. So basically, you're repurposing your tips.
So all the tips you can use.
No, I didn't say that. Because that's what the next thing, that's why I'm showing this slide. That's only with the variant tips. If you're doing it on the glass tips, the clear tips, you got to use this. So you need to take a picture of this because this is nowhere you'll ever find it. Okay. And I don't put this in the book because the Fatona should not know I tell you all this stuff, but I don't really care. Because this is what makes it work.